Hi everyone, I'm Jennifer Roberts. Today we're talking about a topic that impacts many people in the United States. It's diabetes. It's been called an epidemic in our country. We have a great expert to talk to you about it for just a couple of minutes. Dr. Richard Pratley is not only a diabetes expert, he's also involved in the research end of things here at Florida Hospital to try and understand how we can combat this disease that really is taking over the population in many different ways. Dr. Pratley, thanks so much for joining us today.
My pleasure.
Tell me a little bit about how diabetes is an epidemic. What does that really mean? How many people have this?
It's a huge problem. 26 million people are known to have diabetes in our country alone, but that's really only the tip of the iceberg. We think that almost 80 million people are at risk for developing diabetes. Every year, 1 out of 8 of those people will go on to develop diabetes. So that's over 1.5 million people a year developing diabetes. So the problem is huge. We really need to do things to help prevent diabetes.
Pre-diabetes, and that's really where we kind of have some power to impact things to make change. Is that right?
Absolutely. There are very good studies that suggest that if people have pre-diabetes, it's not inevitable that they'll go on to develop diabetes if they take some very simple steps that can help. Those steps include weight loss and exercise. And the weight loss targets are really pretty modest. If you lose between 10 and 15 pounds, and you start to exercise for 30 minutes a day, at least 5 days a week, you can cut your risk of developing diabetes by almost 2/3. That number is huge. If we could get those 80 million people out there doing that, there would be so many fewer people developing diabetes that it would be great for our country's health as well as for our economy.
What are some of the things that people, what do you think is the right way to motivate people to do that?
That motivation is always difficult. Everybody starts out with the best of intentions, especially around January and New Year's, and it's just difficult to keep that motivation going. We really need to make it a family enterprise. Typically people are at risk in families, and so making those changes in diet and getting out and exercising with our families goes a long way to helping the problem. And secondly, there are structured programs that can help people who are at high risk. For example, the YMCA has a diabetes prevention program that's modeled after the NIH program. So it's an evidence-based program that really works, and they can contact their local YMCA and see if they're eligible.
Talk to me finally a little bit about the research that's being done into diabetes at Florida Hospital. I know there's something specific that deals with pre-diabetes that you're working on.
That's absolutely right. We have a lot of studies going on in diabetes, but really we're concerned about how we can help to prevent this epidemic. And so we're taking part in a National Institutes of Health trial that studies whether or not vitamin D can help to prevent diabetes. In Florida here, we hope to enroll 150 patients with pre-diabetes who will be followed for up to 4 years and may receive vitamin D treatment. It's a safe, effective treatment, and we're looking forward to having lots of people join us.
Sounds interesting. We'll look for more research and results on that one. Thank you so much, Dr. Pratley, for your time.
My pleasure. I'm happy to be here.
Okay, great. If you'd like to learn a little bit more about diabetes and are concerned, maybe would like to visit with a physician to understand about your risk for diabetes, go to the Florida Hospital Diabetes Institute website. It's really simple, www.floridahospitaldiabetesinstitute.com.